Time now for our weekend health roundup. So we have ABC News medical unit producer Sony Salzman, one of my favorite people around. So glad to have you here to talk about the headlines impacting everyday Americans. Let's get right into it. We're going to start with Health Secretary Kennedy not recommending some flu vaccines ahead of this year's flu season. One of the key issues here is thimerosal. Why remove that from flu vaccines? And basically break it down. What do people need to know here?
All right, so it is official, Will. Thimerosal, this preservative that's been in flu vaccines, it is no longer going to be recommended, according to our health secretary, Robert F. Kennedy Jr. Now, you might ask, is this a big deal? And in some senses, it's actually not a big deal. Thimerosal, this preservative, it was previously only in about 4% of flu vaccines. So, but on the other hand, what doctors and health professionals are saying is a big deal is that thimerosal has for decades been an anti-vaccine talking point. In fact, Secretary Kennedy, he wrote a book about this, and the allegation here being that thimerosal is linked to the rising rates of autism. Now, just to be clear, no vaccine or its ingredients have been linked to autism in many high-quality studies. But what this is raising concerns among doctors is not necessarily that you or we're going to have more challenges getting our flu vaccine this fall. We're going to be able to get our flu vaccine. Okay. So not really like an access problem, but really what it highlights is that potentially this anti-vaccine talking point has now been codified as official recommendation from a major health agency.
So it goes from the fringes into the mainstream into policy and
exactly.
Law. Okay. Sort of switching gears here, the Department of Health and Human Services, they're taking a closer look at organ donation. You and I were talking earlier. I'm an organ donor, you're an organ donor on the driver's license. But they've said that some people weren't really dead at the time their organs were harvested. What's going on here?
Yes. So as an organ donor myself, this is a story that really caught my attention. So the Department of Health and Human Services, they put out a report where they're really critiquing the organ donation system, saying there are lapses. And this number that jumped out to a lot of people, including myself, these cases of 28 people who doctors presumed they were dead. They were declared dead. The process began, the surgeries began for their organs to be harvested. It turned out they were not actually dead. So this mostly had happened in rural hospitals or lower resource hospitals. But what I think is, really alarming here is just the fact that this is so horrifying. But, before we go there, let's just point out some context. Another really horrifying statistic, Will, is that 13 people are dying every day waiting for an organ. So, we're going to get to the bottom of this story, really understand what happened here. The agency is calling for reforms, but this doesn't take away from the fact that there is a dire organ shortage in this country.
I also think a lot of people do buy into that maybe urban myth that if you're an organ donor and you get into some sort of accident, you're less likely to be saved by medical personnel. There's probably not truth to that, right?
Well, exactly. And what
But maybe we don't know if they're harvesting organs, so we got to find this out.
We are digging to the bottom of this. What we don't know from this report, and which I think is so important, is how rare this is. Our sense is that it is very rare, but it does make a difference if this happened 28 cases in the past year versus the past 28 years. So we've followed up.
Right. If it happens once, that's one time too many.
Once is one time too many.
Okay. And I love this. I'm a huge tennis fan. Venus Williams came back. She's a superstar. She has been forever, but she hasn't played in a long time. She's about 40 years old. But she had a revealing look at one of the reasons she came back. She said that her comeback isn't just because she loved the sport, but because she needed the health insurance. She sort of said it tongue-in-cheek, but maybe it was serious. What does this say about the broader context of the issues with health care and health insurance in this country?
Yeah, I don't have to explain to you, Venus Williams, superstar, one of the most recognizable athletes, obviously.
And super wealthy, too. Anyway.
Yes, well, that's why some people are interpreting her comments as tongue-in-cheek. We don't know if she was joking or not, but regardless, this is sparking a really important conversation about access to health care in this country. As you know, the U.S. is one of the only wealthy countries that doesn't guarantee health care as a basic human right. We don't have universal health care.
Right.
I don't know if you've been to Europe or you've had friends who, they maybe had to go to the emergency room and were shocked, not to receive a bill. Right?
Yeah, where's the bill? When's the other shoe dropping?
It's not like that in the U.S. And even, for people who have insurance, there's some really startling statistics. For a single person, according to a KFF analysis, $8,000 a year. For premiums for a family, $24,000. Now, Venus, what this story is pointing out is that more than half of us we're insured through our job. But if you're not getting that insurance through your job, things can start to get really tricky. And that's what she's pointing out here. I mean, as she said herself, you know, I see doctors all the time. I need this insurance.
Yeah, that makes total sense. Everything you say makes total sense because you're one of the best we got around here. It's so great to be with you. Thank you for joining us for our health alert, our little roundup on the weekend, Sony. We will see you soon, I hope.
Happy to do it.